All right, everybody, welcome to today's Poop Tip Monday. We have a great show tonight. We have a lot of good questions we're going to talk about today. We're going to talk about number one, why your stool may be stinking, and there may be things you can do to get that taken care of you. We'll also talk about the impact of medications on your gut health. Did you know that the medications you're taking actually may be affecting what's going on inside your GI tract? And topic number three, we're going to discuss why you always have to wipe after you have a bowel movement, and I'll give you my recommendations on what I recommend to hopefully get that taken care of for you and get that under control. If you're joining for the first time, my name is Dr. Islam, and every Monday I go live on my social media streams to answer your questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. But let me know if you're watching this live or on the replay, and also let me know where you guys are watching this at as well. We had a great show last week. We had 50 likes, so I'm looking forward to seeing how many people can beat that record as well. Christina, thank you for watching as well. So a quick question. I have a new camera that I am using. I'm trying to see if this camera actually has good settings or not. So let me know in the comments if this is too bright, if it's okay, because I'm trying to figure out this new camera as well. All right, so yes, I'm Dr. Islam. I'm board certified gastroenterologist training at the Mayo Clinic, and come see us at Lubbock Gastro, where we can take care of all your GI needs. I hope you guys had a great weekend. This weekend was good for me. I went to Houston for a wedding. My cousin got married, and oh my gosh, I forgot how much or how hot Houston is. Holy freaking moly. When I went outside, I was just inundated with so much humidity and so much heat. Oh my goodness, I am so happy to be living here in Lubbock, where even though it's hot, it's like 90 degrees, it does not have the humidity in Houston. For those of you guys who are in Houston, God bless you, because it is freaking hot. I don't know how you guys do it, especially in the summertime as well, but it's a great wedding. I don't know if you guys have ever been to a Indian wedding, but they are day long, like multiple day affairs, which it can occur for multiple times as well. So we had a great time. Saw my cousins, saw my friends, so it was a great time. I really enjoyed my time. What did you guys do in the weekend as well? Let me know in the comments down below how your weekend was as well. Joseph, thank you for watching from Manila. All right, Manila so far is the winner for the furthest space where it's at. So don't forget to like and smash that like button as well, Joseph. All right, let's talk about the first question. Hey, Dr. Islam, why does my poop stink? All right. Listen, you'd be surprised how often I get this question, because people ask me all the time, hey, Dr. Islam, my poop stinks. I don't know what's going on. What can I do to get that taken care of? Well, let me kind of delve into why stool stinks, but also what you can do to maybe make it unstinking. So first thing you need to know, it is normal for your stools to stink. Okay, it should not be smelling like perfume or cologne or like a bed of roses, okay? It is literally feces. It is excrement. It is stuff your body doesn't need and it wants to get rid of. So it is perfectly normal. Why it's perfectly okay for your stools to stink. Not a problem. However, there may be times when it could be too stinky. You're like, what the heck is going on? There are three reasons why your stool may be too stinky. Number one could be certain foods that we eat. We know that foods that are high in sulfur, these are foods including things like garlic, onions, eggs, even meat, red meat, have a lot of sulfur in them. This is why also you have sulfur burps. You can have sulfur smelling stool as well. Very common reason why that's the case, that sulfur can digest in your gut, can ferment, and can produce really, 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 really stinky gas from below and cause a lot of gut issues as well. Number two is also high protein. We know that high protein intake can really make your stools very stinky. Listen, I've been in locker rooms. I've been in workout areas. I've seen men chug down these protein shakes. And let me tell you, there's a reason why these rooms stink, because of all that protein, especially synthetic protein, that can make your stools have a lot of gas, a lot of distension as well. Once again, these proteins have a lot of sulfur in them. They can make it more likely for it to stink up your restroom, stink up your workout area, and really cause a lot of problems to occur as well. And lastly, we know that certain foods, including processed foods, can make your stool stinky. So things that are very common here in Texas, beans. Yes, I love beans. I love refried beans, but guess what? Refried beans can make your stool stinky. And yes, artificial additives and artificial sugars can also cause a lot of gas and distension to occur which will increase the sting factor, make it worse, and make it more difficult for you to manage that as well. So keep that in mind. So these are 3 main reasons why your stool can be very, very stinky. So what can you do to resolve that or get that taken care of? A couple things I'm going to recommend. So number 1, obviously changing your diet is going to play a huge role in making your stools less stinky. So if you have a lot of stools, or if you have a lot of food that it has a lot of sulfur component to it, eggs, onions, garlic, minimize that or get rid of that. That's going to make things a lot better for you. Number 2, try to eliminate all artificial sweeteners. These things can cause havoc in your gut, to make your stools very stinky, and to really cause things to be a lot more unpleasant. And then lastly, if you have things like protein shakes or protein drinks, consider vegetable sources of protein, which tends to have less of a side effect of stinky gas whenever you're having that protein. These are things that I recommend to my patients who have stinky stools. Let me know in the comments down below if you know somebody who's had this issue, or you've had this issue yourself, and what you've done to resolve this. I would love to hear what you guys have to say. And if you're worried about your stools, come see us at Gastro, where guess what? We can do an investigation, check out your gut microbiome, and see exactly what is going on. All right, guys. Once again, if you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru. Every Monday, I go live on my social media streams to answer your questions you guys may have. If you have a question or a comment down below, let me know in the comments. Don't forget to let me know if you're watching this live or on the replay, and also let me know where you guys are watching this at. Last week, we got over 50 likes. I need us to break that number. So far, we got 2. Come on, guys. I know you're watching. Add more likes as well. All right, Meg asks, what to do to keep the stools firm? Great question. So there are a couple things that we recommend to help keep your stools firm. So number 1, we recommend dietary supplementation. Fiber can really help those stools to become more firm and allow them to be a lot more cohesive as well. The fiber that we recommend has psyllium in there, Psyllium, and typically we recommend over-the-counter. I typically recommend over-the-counter fiber. The fibers I have found to be beneficial include things like Citrussil and Benefiber, which are synthetic, which you don't have the bloating side effect for that. This is the first thing we recommend to keep your stools firm and to keep it compacted as well. Number 2, don't forget to add water. That hydration is necessary to allow stools to slide through easier, but to keep them together as well. And then lastly, sometimes adding some magnesium at night can hopefully change the softness of your stools as well. Sometimes adding a little bit of magnesium can add that consistency to make it easier for your bowels to go as well. So try these three things to hopefully help out to get your stools taken care of. Let me know in the comments down below if you've tried this or what things that you have done to help out to keep your stools together. And once again, if you want to come see us at Gastro, we can see what we can do to get you taken care of as well. Let me know in the comments down below if you've tried other things to get your stools more firm as well. Great question. Sharon, thank you for watching as well. And Christina, yes, farts are stinkier than poo. If you follow my recommendations on what you can do to get your poo taken care of, you can certainly get your farts taken care of as well. All right. Next question. Hey, Dr. Islam, what is the impact of medications on your gut health? Well, there are a lot of things that the medications you can take can really do to your GI tract to make things better or worse for you. Here are 3 things that typically happen when you take medications. Number 1 is that you can change your gut microbiome. We know for a fact that there are certain medications that are triggers for making your microbiome worse. I'll talk about at the very end of this topic. What happens is that when you take these medications, we do know that it affects your GI tract. Your gut has trillions of bacteria, fungi, and viruses that are constantly interacting with each other. And it is my theory and my belief, and a lot of GI doctors feel this way, that the root cause of why you're having gut issues stems from your microbiome. If we can change your microbiome, that's going to change how your gut feels and how you feel overall. We know medications can do this. It can make things a lot more difficult for your microbiome to interact and to act in a way that's appropriate to help out with your GI tract. Number 2 is that we do know that medications themselves can actually have their own side effects inside the gut. The most common ones being metformin or angiotensin receptor blockers or even calcium channel blockers. And lastly, opiates. They directly affect your GI tract to cause a problem in your GI tract. It's a direct effect as a consequence of taking that medication. It can certainly destroy your GI tract and make things a lot more difficult for you as well. And then lastly, we do know that sometimes you can have interactions with other medications that you're taking that can also affect your GI tract. So it's a combination of multiple different medications that you can be taking that can have a synergistic effect to make your gut out of whack and to make it, not in the way that you want it to be. So what are the more common medications that are notorious to really tear up your gut? Here are 5. Number 1, anti-inflammatory medications, things like Aleve, naproxen, Advil, Motrin. These are notorious for causing erosions, ulcers, gastritis, changing your gut microbiome, and causing a lot of irritation to occur. Number 2 is metformin. Yes, metformin commonly is a good medication for diabetes, but a common side effect includes diarrhea. And a lot of my patients who take metformin actually have a lot more loose stools and a lot more diarrhea than they do when they didn't take metformin. Number 3, pain medications like opiates, things like Loratab, can slow down your gut. And this can have a host of effects, including causing worsening reflux, nausea, vomiting, and constipation. And sometimes it is hard for us to treat that because you're taking that pain medication for legitimate pain, but it has significant GI side effects inside your gut. Number 4, antibiotics. Now, I am not anti-antibiotic at all. They are life-saving medications that you need if you have a bacterial infection. But keep in mind, this also can cause a havoc in your GI tract, including changing your gut microbiome and leading to other conditions like C. diff diarrhea, which are really bad diarrhea that can make things worse as well. I have a couple of videos on tips and recommendations that I recommend. Let me know in the comments down below if you want me to go into more details about that. And then lastly, number 5, angiotensin receptor blockers or ARBs. These are medications that end in artan, and they very commonly can have diarrhea as a side effect as well. So before you stop these medications, don't do that until you speak to your healthcare provider to see if these are the medications you should consider changing or altering as well. But let me know in the comments down below if you've noticed you've had a change in your GI tract from certain medications, and what medications do you think have caused those issues for you? All right, great question that we have here. All right, if you're joining for the first time, my name is Dr. Islam. Yes, I am your poop guru. My passion every Monday is to give you correct information based on science on the questions you guys may have. If you haven't already, a couple things you need to do. Number 1, come see us at La Gas Show for all your GI needs. Number 2, don't forget to let me know if you're watching this live or on the replay. And number 3, let me know where you're watching this at as well. So far, the winner is Manila for the furthest space where it is. Don't forget to smash that like button. Let's see if we can beat those 50 likes that we got last week as well. All right. Next question. Hey, Dr. Islam, I'm still wiping after I poo. What is going on? Let me know in the comments down below. Maybe if you or a friend of yours may suffer from this condition. Listen, it is a very common condition to not be able to feel clean after you use the restroom. Listen, I hear this all the time from a lot of my patients. Don't be ashamed. Don't be afraid, and tell me, if you come see me in the office, if this is an issue as well, and tell your doctor, hey, I'm having this issue. I don't feel clean. What is going on? All right, there are 5 reasons why this is going to be going on, and I'll give you 3 tips at the end of what I recommend to get this taken care of for you. So number 1, you may have just slimy poo, and this can be due to a lot of different medical conditions, including conditions like irritable bowel syndrome or IBS, especially the diarrhea component. Maybe you have Crohn's or ulcerative colitis as a cause for this as well. Maybe you have some other disease going on inside the rectum to cause your stools to come out slimy. Maybe you have a colitis going on to cause your stools to become slimy. When you have kind of loose stools and slimy stools, that can cause you to feel a lot more unclean down below. Your rectum is not an area that's used to having kind of loose stools. It wants to have firm, solid stools. That's the whole point of the rectum. And so when you have watery stools or loose stools or even slimy stools, it can seep through the bottom and cause you to not feel like you're cleaning yourself completely. Number 2, a second reason is that you actually may be wiping wrong. Yes, that's crazy, but it's true. Wiping with toilet paper actually can be detrimental for you to keep yourself clean. Toilet paper is not the most effective way to keep yourself clean down below, and I'll talk about, my recommendation at the end of this video as well. But wiping with toilet paper is not the right way to wipe, and this could be another reason why you're having difficulty keeping yourself clean. Number 3, you maybe didn't completely empty your bowels. A lot of my patients suffer from a condition called pelvic floor dysfunction. And what this basically is that my patients feel the urge to go. Then they go, but they don't feel like they're completely emptying everything out. There's still stool in the rectum. And the main reason for that is because the rectum muscle is so tight, they're literally retentive and stool cannot pass through. So it's a very common reason for people to have issues, and they have to use the restroom again and again and again. And this can cause people to not feel completely clean. Reason number 4 is that you actually may be suffering from what's called fecal incontinence. And this is when you don't feel the urge to use the restroom, but all of a sudden you soil yourself, or you feel the urge to go, but you can't make it in time. And this is typically due to a problem with the muscles of your rectum. Normally at rest, your rectum muscles are always tight. They're contracted all the time. And so when you have a bowel movement, it relaxes to allow things to pass through. When you have incontinence, either from trauma or episiotomy or pregnancy or even age, that rectum muscle is loose. Things pass through. This can lead to someone to not be clean. And then lastly, the most common reason I see for people to not feel clean after they wipe are hemorrhoids. Yes, hemorrhoids can trap stool in the rectum. And whenever it traps stool, it causes you to feel like you're not completely clean. And it causes you to feel you have to always wipe yourself and get that, taken care of. And that causes the sensation of just not being able to be fully clean. So now that we talked about the reasons why you may not be fully clean, let me talk about what we can do. So number 1, I recommend this for everyone. Get a bidet. Oh, they're fantastic. I've had them. I use them. If you go on my website, I have bidets that I recommend. It is a very effective and really great way to keep yourself clean. If you've not used a bidet, it's going to change your life. Number 2, consider using wet wipes to clean yourself. Now, there are certain wet wipes that have other ingredients in them, like aloe, which works very, very well to keep your rectum clean, but also not cause it to be chafing. So consider using wet wipes. And then lastly, get those hemorrhoids fixed. Having a dirty bottom or not being clean down below is a sign of hemorrhoid issues. Come see us where we can get your hemorrhoids taken care of in a quick, easy, and painless fashion. We do hemorrhoid banding, so this can resolve the issues, get to the root cause of why you're not clean, and hopefully prevent them from coming back. If you want to learn more, come see us at Gastro. We can talk about exactly what we can do to get your hemorrhoids fixed, but also we can talk about what we can do to keep you clean down below. Let me know in the comments down below if you suffer from this or if you've had any other issues like this, so we can answer future questions you guys may have for us as well. All right, it's a great question. I'm glad you guys had asked that as well. So let's see. All right, perfect. So Christina asks, what causes a spasm in the very bottom of your bottom? Great question. All right. There are a number of reasons why people can have a spasm. Number 1 could be what's called a fissure. That's a tear in the rectum. Usually a fissure is due to either being constipated or straining, which you pass out a pretty big stool, and that can cause a tear to occur, and the tear can cause your rectum to spasm up. We can typically see this with a rectal exam, and we can treat this with a nitroglycerin cream. Number 2 is that you can have that condition called pelvic floor dysfunction, in which you are literally retentive down below. You cannot relax that rectum, and that inability to relax will cause your rectum to spasm out, and that can cause issues to occur. Number 3, you could have a condition called ulcerative colitis, in which you have inflammation going on inside that rectum to cause you to spasm as well. And we can typically diagnose this with a colonoscopy. And then lastly, hemorrhoids. Hemorrhoids are a very common reason why people spasm, and sometimes using over-the-counter treatments to get these hemorrhoids fixed can help that out. But the best thing you can do is to get your hemorrhoids permanently fixed by coming to see us, where we can get that option taken care of for you. It's a very common reason why people have that spasm is these hemorrhoids, and getting that fixed hopefully resolve the issue as well. Don't suffer in silence by these rectum issues or these hemorrhoid issues. Come see us where we can get this taken care of for you in a quick, easy, and safe fashion as well. All right, great question, Christina. Thank you for that. So Joseph asked a very good question. Can IBS affect the texture of your stool? Great question. So the question is, can IBS affect the texture of the stool? The answer is, without a doubt, yes, it can. We have a couple different types of IBS. We have IBS diarrhea, we have IBS constipation, we have IBS mixed in which you have both, or we have IBS unclassified. But the hallmark of IBS, no matter the subtype, is that you have pain, you have a change in the stool caliber and the stool texture. That is the hallmark of IBS. So yes, IBS can change the texture of your stool. But here's what you need to know. There are a couple of things that are what are called warning signs when it comes to IBS that makes us think that something else is going on beyond just IBS. Here's what you need to know. Number one, if you have a new change in your texture after the age of 45, this could be a sign of colon cancer. Number two, if that texture includes rectal bleeding. Bleeding is never normal. And unfortunately, I've diagnosed somebody last week under the age of 40 with new onset colon cancer because their only symptom was a new change in bowel habits with rectal bleeding. That is completely something that could be a sign of something bad going on. Number three, if that change in texture is associated with really bad weight loss. Weight loss is not normal, especially unintentional weight loss. That's something we don't want. Number four, you have really bad abdominal pain with that change in texture because pain could also be a sign of something going on in your colon. And then lastly, if you have that change in texture that includes having stooling in the middle of the night where it wakes you up, that is also considered a warning sign which we should not ignore, which we need to do an investigation, find out exactly the reason why, and hopefully get that resolved for you as well. So great question. A change in texture is part of IBS, but keep in mind these warning signs, which are not part of IBS, which would be a sign of something else going on inside your colon, which we need to do further investigation to find out exactly what is going on. Great question. All right, if you're joining for the first time, my name is Dr. Islam, and every Monday I go live on my social media streams. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Let me know if you're watching this live or on the replay. Also, let me know where you're watching this at as well. So far, Manila is the winner for where we are watching this. We're the furthest place out for someone to watch their live stream as well. All right, let me go through some of the questions that people have here so far. All right, perfect. All right, guys, good question so far. All right, I am going through the list. I don't see any much more questions. Australia, Meg watches in Australia. All right, maybe you're the winner so far. Dan, thank you for watching. Victoria as well. All right, so I think we are okay with our Poop Tip Monday, unless there's any other questions. Don't forget to let your friends know that we have Poop Tip Monday. Come join us. Join us next week where we have a great show as well. Come see us a little bit gastro. We can get your GI issues taken care of. Don't forget to smash that button, like, share, and subscribe. Thank you for watching, and we'll see you guys next week. Thanks, guys. Take care. Have a great day.